Hi everyone, I'm making a quick video in follow-up of my last video, and the question is, can I do AMC Clinical from overseas? And how do I come to Australia to do AMC Clinical? So in my previous video, I explained about getting a job from overseas. So now we will talk about AMC Clinical. So the question is, can I do my AMC Clinical for overseas? Unfortunately, no. It was possible in COVID until 2024, until last year. I did my AMC Clinical online, but now it has changed. Now we are back to the pre-COVID exam, which has always been face-to-face exam. So we only had 2 or 3 years of online exam because of the COVID. They stopped that, and now the exam is again face-to-face in Melbourne. So you have to come to Australia to do your AMC Clinical exam. And then a lot of people ask me, how much time do you reckon to prepare AMC Clinical? I think it's because it's an expensive exam that you have to come. I would give it a fair amount of time. So I would say 7 to 8 months is a good amount of time, but take 1 year if you need. It's a very expensive exam. You have to come here, you have to pay flights, you have to pay accommodation, you have to pay visa. Make sure you are well prepared rather than just jumping and doing the exam, okay? I already have a video about how to prepare for AMC Clinical. I did Dr. Amir course. I explained everything about that in that video, so I'm not going to go in detail about preparation. And again, what can you do as a plan? So you can do your AMC1 in your home country. You can apply for jobs and prepare for AMC2. So let's say this will take you 1 year. And let's say you feel like very ready and very well prepared for AMC2 and you have the money to come to do the AMC2. So what you will do is you will apply for a tourist visa to Australia. You make it rejected the first time, but apply a second time. Or always the best thing is to find people who have applied to Australian visa, tourist visa for exams and got accepted and came to do the exam. And there are many people who are coming for overseas to do the exam. So get in contact with people from your own home country who did the process and know what did they upload, what did they submit to get their visa accepted. They are everywhere from every part of the world, people coming to do the exam and they get their visa accepted. So you apply for a tourist visa, you come, you do the exam, and you use this amount of time that you have onshore while in Australia to apply for jobs and tell them, hey, I'm here in Australia. You email everyone, tell them that you are in Australia, you are living in Australia, and see if you get a good response. Because as I said in my previous video, there are higher chances of getting a job if you are already in Australia. So that will be the strategy, to do both things at the same time. So you come, you do your AMC Clinical, you don't stress about the results, you don't stress if it went bad. It's okay, you tried, you did your best. Now you have 3 months, which is the amount of duration of the tourist visa, to aggressively try to find a job and get an interview at least while you are in Australia. So that would be my recommendation of another way how to plan things if you are well prepared for AMC2. And I think this is a very good way to do it, because if you pass AMC2, you will get the results within 3 weeks. And then your application and your CV become much, much more stronger. So you become someone who is already in Australia, who has AMC1 and AMC2. And definitely there are some hospitals that prefer someone with AMC1 and AMC2, and you just email them and they will consider you for an interview. So it has a lot of benefits. It's risky because you may fail the exam, which is okay. If you fail. It's not the end of the world, but we aim to pass. That's why you have to prepare very well. But if you pass the exam and you get your visa, so if you get your visa and you pass your exam, you are already winning in a lot of steps. So you come, you do your exam, you start applying, and then you pass your exam, and then your application becomes much, much stronger as well. So yeah, that would be my general advice as well about AMC2 timeline and how to come to AMC2. I'm not a migrant agent. I'm not aware if there is any other type of visas, but I'm aware that the tourist visa is the one that you use more to come to do the AMC Clinical. And that's it. And thank you. This is a very short video, but more videos will come maybe next week. So subscribe and follow me. And if you have any questions, so I'm actually on Instagram as well. So my page is Dr. So if you feel better texting me there, I'm happy to have a look at the messages and guide you a little bit. But you can also drop a message in the comments section. So Instagram or YouTube. Yeah, so that would be my Instagram, and you can also leave a comment. And that's it. Thank you so much.